Upper eyelid blepharoplasty is performed through a small incision that occurs in the upper eyelid. Now there's a natural forming crease, usually about 10 millimeters from the lash line, that forms when we open our eyes. That crease is used as the inferior end of the skin incision. That skin is incised and the extra skin above that is removed. Now, of course, it's important that some extra skin will be left behind so that patients can open and close the eyes comfortably even after the skin is removed. In addition to that, for patients who require it, a small amount of the orbital fat is removed from behind the eyelid structures. A small incision is placed in a structure called the orbital septum, and this allows for access to the fat and gentle removal. Once this is completed, the skin and muscle layer is closed with stitches that generally need to stay in for about a week. So in the schematic diagram of the upper eyelid, what you can see is that there's extra skin from above that crease line that's hanging down over the crease. That crease is called the supratarsal crease. When the skin hangs over the crease, it gives the impression that the eye is more closed or more heavy. In some cases, it sags or hangs over so much that it has a curtain effect on the eye, such that patients can often have trouble seeing in the lateral and superior aspects of their visual field. It's almost as if there's a curtain of skin that's folding down over their eye. Here's an example of a patient who I performed an upper blepharoplasty for. She had a little bit of extra skin, although it's not severe. She does have some extra fat that sits behind the eye as well. And this fat, although it's normal and is not related at all to body weight, seems to bulge forward as we get older. The eyelid structures are not quite as tight as we age, and so the fat that normally sits there in good position starts to bulge forward with time. So in her case, I made a small incision in her supratarsal crease, again about 10 millimeters from the lash line. I removed the extra skin that was above that incision line, and I also accessed the retroorbital space to remove some of the additional fat that was bulging forward. It was then closed with stitches. Stitches were removed after a week, and this is how she looks about 6 weeks after the surgery.